This video is rated M for mature. I recently had surgery on my butt. I had several procedures performed under general anesthesia by Dr. Raymond Staniunas here in Memphis, Tennessee at Baptist Memorial Hospital. I had an exam under anesthesia, a sphincterotomy, and a fissurectomy, and then skin tag removal. The sphincter is a circular group of muscles surrounding the anus. They are responsible for controlling bowel movements. A sphincterotomy is a surgical procedure used to treat anal fissures that are not relieved by conservative measures such as changes in diet and taking stool softeners. A sphincterotomy, also called a lateral internal sphincterotomy, is a type of procedure that is used to cut into the anal sphincter, and the aim of this incision is to release the tension on the sphincter. When the pressure is too high, the anal fissure is unable to heal. An anal fissure is a small tear in the thin, moist tissue that lines the anus. What are the causes of a fissure? Some of the causes include chronic constipation, straining during a bowel movement, and childbirth. What are the problems due to a fissure? You can have severe pain, burning, itching. The symptoms that you have during a bowel movement can last hours after the bowel movement. You can also notice blood or spotting when you pass hard stools, anal spasms, and a skin tag that can be felt at the anal opening. What if these problems are left untreated? Infection of the fissure leads to pus forming in it. The fissure will become chronic, and you'll go through periods of pain-free and painful, but the fissure will eventually grow deeper and turn into a fistula. And I ended up getting a fistula. A fistula is a connection between two internal organs or an organ and the skin that shouldn't be there. So basically like a channel or a tunnel where stuff is connecting and it's not supposed to be connecting. The development of a fistula in the anal area commonly begins with an infection, and it starts with an abscess. During surgery, the doctor will treat the damaged area, cauterize the tissue, and this is pretty good because you won't have to worry about stitches in the anal area. What is a fissurectomy? A fissurectomy is a surgical treatment option for anal fissures. The fissurectomy consists of removing the fissure along with the surrounding skin. Some of the risks of these operations include incontinence. Incontinence can be two different types. You can have fecal incontinence and gas incontinence. I dealt with both on my first day after surgery. But thankfully, those issues went away as time went on. I had to have a special diet before surgery. After surgery, I made sure to keep a light diet for the first 4 days. I ate cough drops, crackers, popsicles, and I drank a lot of water and Pedialyte. I had some very painful days during recovery. But the pain during recovery is much different and milder than the pain of dealing with the actual fissure. The pain that I was dealing with before was absolutely debilitating. Watch my previous video called How I Treated Hemorrhoids and Anal Fissures in 2 weeks, and you'll see that I have been struggling with a torn fissure for a while now. Quick recap. Back in June 2023, my butt pain was excruciating, and I was too scared to go to the ER. So in August, the pain reached excruciating levels again, and that's when I finally went to the ER. Now, back in June, I knew I had pain that was severe and it needed medical treatment, so I called my GI doctor and I requested a referral to a colorectal surgeon, but my GI doctor told me that I could only get a referral if I came into their office for another visit. We haven't seen you in a year, so you gotta come here for another visit before we can refer you. Okay. But due to the doctor's schedule, I had to wait 3 months for a visit. After I scheduled the appointment, I had to deal with my visit being rescheduled because of the doctor's schedule. All of this just to get a referral to the colorectal surgeon who was right down the hallway from the GI. So from June to September, while I was waiting on my appointment with my GI doctor, I had to create some bizarre ways to deal with my pain and treat my symptoms. All of these ways are detailed in my video called How I Treated Hemorrhoids and Anal Fissures in 2 weeks. In September 2023, I was finally able to go to my GI, and he referred me to the colorectal surgeon the following week. My colorectal surgeon examined my butt But considering the area was already aggravated, the exam hurt a bit. But once I saw the colorectal surgeon, he scheduled me for surgery right away. Funny enough, my GI doctor never examined my butt when I would go visit him. His nurse would always ask if I consented to an exam, which of course I agreed to, but it was never performed. And my surgeon said the pain that I was feeling was not specifically related to the hemorrhoids. It was the fissure. So I feel like if I knew I was just dealing with the fissure, I would have moved differently. Things would have been a lot better. I probably wouldn't have been in pain and been suffering for so long if I would have been recommended for surgery when I first saw my doctor, my GI doctor back in 2022. If he would have did the exam and actually looked at the area or touched the area to see what was really going on. Before surgery, the nurse gave me a pack of warm wipes to wipe my body down with. You can only use one wipe per limb. After that, I was given mouthwash and nose swabs to sanitize my mouth and nose before surgery. I was told that I was given an antibiotic injection during surgery. For post-op, you can wear a pad in your underwear to absorb drainage, or you can wear adult diapers. I picked the adult diapers option after a few days just because it was a bit more convenient. I did my best to mimic how they dressed me during surgery, and during surgery they put gauze and a bunch of cloth up in the area to catch drainage, so that's what I did even when I was at home. And I was advised not to lift anything over 10 pounds while I was recovering. The nurse told me that day 3 and 4 would be the worst in terms of pain, and she was not lying. So for pain management, I was prescribed tramadol, acetaminophen. It's a narcotic, and it can be used to treat moderate to severe pain. But it has a high risk for addiction and dependence, and it can cause respiratory distress and death when taken in high doses, or when combined with other substances such as alcohol and other illicit drugs. So leading up to surgery, I was super worried about how I was going to find the pharmacy and get my medicine while I am half-baked and sore from being in surgery. But thankfully, the pharmacy delivered my medicine to the room. I was so shocked. I never knew they did that. And after surgery, I went to my mom's house for some TLC and to recover. Like I said earlier, I experienced incontinence on the first few days after surgery, but it did go away. And I didn't have any pain on day 1 after surgery. I went to the bathroom and I felt no pain. I was like, oh, I would have did this surgery a long time ago if I knew it was going to be painless. By day 2 and 3, I started to experience some mild pain, but I could handle it. So I started to slack on taking my medicine around the clock, which turned out to be a big mistake. By day 4, I realized I messed up by not taking my meds on time. Basically, day 1 had me out here really feeling false confident. By day 4, I realized I messed up by not taking my meds on time. I'm not sure, but I think my doctor gave me some painkiller shots around the surgical area, and I think that's why on day 1 it was pain-free, and then day 2 through 3 was kind of mild pain. So my guess is that the medicine wore off by day 4, and I'm skipping doses of painkillers, so all of the painkillers were worn off and eliminated from my body, and that's why I feel like day 4 was the worst day. But let me tell you why I was skipping painkillers, okay? While recovering at my mom's house, I watched the docu-series on Netflix called Painkillers. It's about the opioid epidemic. And I'm just seeing how these people getting messed up on opioids, and I'm like, oh my God, tramadol is an opioid. Oh my God, I don't want to end up like them. So I wasn't taking my medicine regularly because I was afraid that I was going to become addicted to it. Logic, right? I'm not trying to get hooked. My routine is to use the bathroom, soak my butt in the cold sitz bath, and then I take a shower. I went to the bathroom on day 4 and the pain was so bad that I almost passed out. I was in my mom's shower and I was about to faint, and her shower has glass panels. And I'm like, if I pass out in here, if I crash out, I'm gonna crash through this glass. I'm gonna be SOL. I can't fall out in here. This was the day that I finally started back taking my medicine consistently, and I would take it every few hours. But me being me, I didn't eat enough with the medicine, and that made me nauseous. So this was the day that I decided to just come back home and get my life together in my own house, apartment, and my own environment, because the pain was just too much. The pain from using the restroom after surgery feels a lot like the pain you get after eating spicy food. I call it spicy booty. So if you're eating hot wings and jalapenos and just spicy stuff, you're going to feel that spicy booty feeling as the food comes out of your body, but you know you didn't damage anything, right? That's what fissure surgery feels like. But the fissure, when you're dealing with it in the first place, feels like pooping out shards of glass, and your brain can't help but think, oh my God, internal damage. So it's really like picking your pain, because the pain from the surgery is temporary and one of the risks is incontinence. And then the other type of pain that you'll feel will be spontaneous, and it could reoccur throughout your life if you don't get your issue fixed. After I go to the bathroom, I do a cold sitz bath. I use a proper bowl/basin for my cold sitz baths now. Before surgery, I talked to the medical students about my cold sitz bath, and they were impressed. They were like, okay, interesting. Thanks to Baptist, I was awarded over $11,000 in financial assistance to fully cover my surgery cost. And I just want to say that everybody that I encountered on the day of surgery was amazing. The receptionist, the nurse, the custodial workers, the doctors, the medical assistants, everybody was amazing. For a while, I'd been self-medicating with herbs of the kind that you light on fire. But something told me to stop, because I was having surgery soon. And I was thinking, well, I've been losing weight, and I've been having consultations with plastic surgeons, so I'm going to be getting plastic surgery soon. Little did I know, I was going to be getting a sphincterotomy soon. So I'm glad that I listened to my intuition and stopped self-medicating, because it gave me the ability to get actual medical help. I had the nurses cracking up. I was telling them that I wish I was getting a Brazilian butt lift surgery. I still squat when I use the restroom. I'm avoiding extracurricular activities for now, until I'm fully healed. And I'm still using Revival XR Bum Soothing Sitz Bath Soaks. Due to the price of the bum soak, I sometimes use the Revival XR Postpartum Care Salt Soak. The postpartum soak is currently half of the price of the bum soak, and it has similar ingredients. The medicine prescribed by my doctor is a compound that has lidocaine, diclofenac, metronidazole, and nifedipine, which is a painkiller, steroid, muscle relaxer, and an anti-inflammatory, all wrapped up in one. I'm supposed to insert a toothpaste-sized amount into the anus to help with discomfort, and I always use a gloved hand to administer my medicine in that area. Some days I don't need to take Miralax. It just depends on if I stay hydrated that day. And if I do take it, I've been taking it in a lower dose and not taking the entire dose. But I am seeing some people here on YouTube say they have been taking the Miralax for months after surgery, so I'll consider that. My 2-week post-op visit went well. My doctor explained a lot about my surgery and my anatomy to me, and he did not have to probe me when he examined me this time. He just looked at the area. And it's crazy because I stayed up all night the night before my follow-up visit, because I was so scared that he was going to have to examine me like he did the first time, and all in all, I was worried for nothing. So far, I'm feeling fine. I'm feeling good. I still take Tylenol occasionally when needed, but overall my pain after using the restroom is nowhere near as bad as it used to be, and I'm doing much better. Comment and let me know what you have been doing to heal your fissure or your hemorrhoids, and let me know if you've gotten the sphincterotomy or if you're considering getting the sphincterotomy. Remember, when the waves of life throw sand at you, make a pearl. Bye. I've filmed in front of anybody before, you know, new things, but it is surgery day. on my way to Baptist so I can get my sphincterotomy procedure done. I think that's how you pronounce it. And what they're gonna do is basically going into my butthole, and because it's too tight for the anal fissure to heal, they're gonna go and cut some of the muscle so that it is loose and able to heal up the fissure. So yesterday I couldn't eat. I had to be on a clear liquid diet. I tried to have clear Jello, but it was so nasty I threw it away. So I just had clear unflavored Pedialyte and water, and that's it. And then today I couldn't eat it at all. And of course you can't eat on the day of surgery, because if you have food in your stomach, there's a risk that you could aspirate on your own vomit and you could die. So I'm following all the rules. I made sure to get dressed or get up, get showered this morning. No deodorant, no lotions, of course. So yeah, I'm not looking forward to this, but I gotta do it. I'm loving the signs. Don't let fear overtake your faith. God will never put more on you than you can bear. Till you get an answer, continue to pray. Yes, I know.
I need it for myself, so I have to share it.
It's 11/11. Make a wish. My wish is to be pain-free and living a vibrant life. Bro, look at this. You see that? It's all the way in my skin. I don't like IVs in the hand. It's freaky to me. I'm gonna have surgery on my booty hole. I had to come in and use the wipes. Like 6 wipes. So you do one arm, you do the other arm, do one leg, do the other leg, front part of your body, back part of your body. Don't wipe your face and don't wipe your private parts. And then had to do a pregnancy test, negative. And then I put all my clothes in a bag, and the nurse is going to get my mom right now. So yes.
You want to get your warm blanket today?
Yes. Got you on camera, candid camera. Candid camera. Yeah. Hey. Okay. I should have flipped it. I should have flipped it. Not me trying to be a famous vlogger. I need a nap though. It's not warm anymore.
Why they put that in your hand?
She couldn't find my veins in either arm. I was like, bro. I know it already is bugging, because my you know, is everything moving around in my hand and I can feel it. Yeah, she couldn't find my veins, and part of it.
Next time when she go call for a phlebotomist.
Right.
Don't let them do that unless they have to. They blow the vein in your hand.
Yeah, she was poking all around in my arm, like
don't let her
trying to find it.
She like digging.
I just found out. I'm laughing, but I'm not in a good mood. I'm not mad about that. I just want to be done with this so I can be sure my happiness is not like fleeting. You know what I mean?
Hey, just trust the process.
Trust the process. My booty will be operated on. That's a booby. That's just a.
No, it was more than just a booby.
But like, you know what I mean? After surgery, I gotta take a shit. That's what I'm scared of.
Yeah.
That, you know what I mean?
I know.
Yeah. Okay, back to what I was saying. So, how about I just found out my surgery is actually scheduled for 2 p.m. I was originally told to get here by 11. Then I got a phone call this morning around 9:30 saying come in early. Came in early. And the nurse is like, So your surgery scheduled for 2 p.m. Who finna sit here that long? That's crazy. That don't make, I mean, what I'm supposed to be doing? My phone finna die.
It's kind of warm. However, if you're cold, there's plenty of
Ron just likes to run his mouth.
I see. I'm over here like, I wish this procedure was for something like a BBL or something. Let me get some lipo or something. Yes. Okay. Let me wake up beautiful.
I'm gonna be wrapping some brown Coban around, and you can just take that off when you get home. All right.
Not me looking injured.
All right. Once you're dressed and ready, and she leaves to get the car, you'll just hit that red button. I'll come get a wheelchair and we'll get you home.
Okay. Got all these little pieces of tape on my face from where they had to give me the tube so I could breathe, but I made it through surgery. So right now I don't feel any pain. I was feeling some pain earlier and I got some painkillers via IV. My lips are swollen from where they put the tube in my mouth. I'm about to go soon. They gave me some juice and ice chips. My voice is still really raspy. I'm still groggy, but I'm glad to not be in pain and glad to be alive. Now I'm headed to my mom's house so I can recover. I can't wait to get home and get this stuff off my face, but as you can see, I'm dressed, waiting on my mom to get the car up to the front door, and then the nurse is gonna get a wheelchair so I can roll out. I'm a little nervous about sitting directly on my butt. I don't want to feel any pain at all. We'll see how that goes in a few minutes, but as of right now, I'm not in any pain. My nurse has been so nice. All of the nurses have been so nice. The people, the medical assistants have been excellent, very professional. They explained to me my anatomy and what was going on. I have to go to my doctor in 2 weeks for a follow-up. So right now, I just have to focus on recovering and healing. According to my doctor, this particular procedure was going to eliminate my pain that I've been having from my fissure. My GI doctor wasn't examining the area whenever I would go for my appointments. He would just recommend Miralax and fiber or sitz bath. So this whole time I didn't know. Thankfully, my GI doctor finally referred me to a colorectal surgeon. The colorectal surgeon looked at the area and he was like, I recommended you for this surgery. Yeah, that was on a Tuesday. And by Friday, I was getting a call from the doctor's office saying that I had surgery scheduled and that I needed to come in for my labs. So I went in the following Tuesday for my labs. And then today being Monday, I went in for surgery. So everything has been happening really fast. Straight out of surgery, I have to get home, get a shower, get some type of oil so I can get all this off my skin, because I'm having to like claw into my face just to get that little bit off. But yeah, my nurse should be coming very soon to get me in the wheelchair. If I don't get to sign out, I'll go ahead and sign out right here. Thank you so much for watching today's video. Thank you for going through this journey with me. And I wish you luck on your journey with either hemorrhoids or fissures. This has been a long road. Thank you so much for watching. Bye.